Here I'm with Dr. Goldfarb here at the VA NYC in Manhattan, and they went live today with Tablo. And the amazing thing is Dr. Goldfarb had the charge with the Tablo himself and set it up and got the patient started. How was the experience this morning?
Well,
this afternoon?
It was amazing. Of course, everybody knows that nephrologists understand how dialysis works, but they don't actually know which button to push on the machine, except for the one that turns off the alarms. And I was able to start dialysis today by myself, really. I'm not sure that I should say by myself because you were here, Antoine, and of course, you know, I deeply appreciate all of your help and teaching, training, and it made it actually possible. So it went pretty well. And then Dr. Clay Block, my buddy from the White River Junction VA, was here as well, and he did two as well. We're going to go take one of the patients off right now, and this really helps us because it's not what we wanted to do, but extends our dialysis unit. We've lost staff. We have a limited ability to do as many hemodialysis treatments as we want. We're short on even peritoneal dialysate fluid. So this was really an important advance for us, and I appreciate you and Outset Medical, Dr. Aragon, and all of you helping.
Thank you very much for that testimonial. And look forward to more Tablo usage in the future and getting our patients treated and back to normal.
Exactly.